Hey guys, okay, so today we're going to talk about elbow health, and keeping your elbows healthy is crucial. You don't want to develop two things. One is tennis elbow, which I experienced for about a year. It was really hard to get rid of, and that's tendonitis, kind of on the outside portion of the elbow here. They call it tennis elbow because it's more of a motion like that. That will cause the tendonitis and pain here in the elbow. And then we also have the golfer's elbow, which would be right through here, these tendons on the inside of the elbow. And that is from improper lifting by pushing the pressure this way. Okay, so we'll go over a couple things, how to and what not to do for those. Okay, first thing we're going to go over is tennis elbow and keeping the arm at 90 degrees. Okay, so 90 degrees, you can see as I'm doing a lat pull down, my arm doesn't go past 90 degrees, or it's slightly past 90 degrees, that's okay. What we don't want to do, so because we're driving the elbow down, this is for lats here, right? This is how we work our lats. We pull our elbow down to the ground, not back like this, because now look, I'm pressed in here, I'm putting all this pressure, I can even feel it right here in my elbow, okay? So we should be right here, 90 degrees. Now we're going to touch on golfer's elbow, so here on the inside, okay? So what causes that pain and the tendonitis to flare up through there is this type of motion, where we're pulling our arm and we're loading it all right here and putting all that stress on the inside of the elbow here. Okay, so if you're doing a high to low chest fly, you wouldn't bring the elbow down and pull it in like this, okay, because there's a pressure. So we want to bring that elbow up and come down. There's no pressure there on the inside of the elbow. Here's another one for the tennis elbow, so the outside part of the elbow. What we don't want to do is do this type of rotation to where we're bringing this up. So if we're doing shoulder lateral raises, see how my arm is stuck in this position? And I'm hinging here. I'm not getting here and then rotating up with this hand. So I'm leading with the elbow. No pressure here. When I do get pressure there, is when I start wanting to bring it out like this. That's a big no-no. So drive with the elbow up and not trying to bring it up like that. Another common one that I see that's going to create golfer's elbow is when doing dumbbell flies or even presses. Okay, the flies will be outside here. We don't want to keep our elbows out like this. We're putting a lot of pressure on those joints there. So we keep our elbows in, turn the hands, and then we're here. Okay, you can turn them, a lot of guys will turn them on to the inside. I like that. You get a little more chest activation on the inside of the pec. That's fine, but you do that at the top. You don't do it out here. Look at this elbow now. I'm trying to control the weight here. Okay, it's here, 90 degrees, number 2. Okay, we start getting out here, we start using different muscles. So 90 degrees, we're close to. We can rotate up the top. I have no pressure on the inside of my elbow. When doing an exercise like a low to high cable fly, I'm trying to get a good angle here so you can see the difference. What we don't want to be doing is pulling this way. A lot of pressure here. See, my arm is out and I'm pulling up like this. A lot of pressure on the inside of the elbow there. So what we want to do is bring that elbow out. And now we're all right in here in the chest, on the front delt, and nothing on the elbow. Okay, so this is how we want to do it, and how we don't want to do it. So get that elbow out. Really get that mind muscle connection on the muscle that you want to be working. You should not be feeling it anywhere in the elbows. If you are, you know you're too far out. Okay, here's another good one that you guys should all have in your program. This is a lat pull down. And this is going to be all about grip, right? So when I'm in here, when I'm in too tight, I'm going to come down. I'm pulling it right beneath my chin, as close to my chin as possible. Well, look at how much past 90 degrees I am. A lot of pressure here on the joints. Okay, so that's when I'm in here. When I'm out here, now when I come down, I'm in a 90 degree on both sides. Okay, so this would be too close. You can see where my hands are, pretty close. Way past 90, a lot of pressure on the elbows. So what we don't want to do there, so I'm going to bring my grip out so I can come down at 90 degrees. Okay? Pretty damn close to 90. That's what we want. Okay, that wraps up the elbow pain and injury prevention video. You know, you may not feel the elbow pain at first. You should probably feel pressure, but eventually it will catch up with you. The elbows will start to give you problems. And once you have problems, it's really tough to reverse it. If you guys are having problems with the elbows, let me know. And there are some peptides that can help with that. I actually healed mine doing that a couple years ago. Okay, thanks for watching, guys.